Welcome to the USC Norris Comprehensive Cancer Center. Beginning cancer treatment can feel overwhelming. At USC Norris, our staff has created a welcoming environment in which you will receive exceptional care. We'd like to take a few minutes to introduce you to our facilities and your healthcare team. We hope this will help paint a picture of what you can expect as you begin your first day of treatment. Your treatment may include different types of therapy given intravenously or orally. Traditionally, chemotherapy works to slow or stop the growth of cancer cells by interfering with a process that all cells need to survive. Other forms of treatment include targeted therapies, which focus on cancer-specific processes, and immunotherapies, which help our immune system to recognize and destroy cancer cells. No matter what treatment is right for you, your physicians and nurses will work closely with your clinical oncology pharmacist to optimize your treatment and address any side effects. Prior to the start of treatment, your pharmacy team will perform multiple independent checks on your treatment plan, including laboratory monitoring, dose calculation, and dose verification. Appropriate supportive measures including anti-nausea medications, hydration, steroids, and antihistamines will help ensure your treatment is well tolerated with minimal side effects. Patients may wish to meet a pharmacist to address any questions or concerns. Please don't hesitate to ask your nurse for a pharmacy consultation. If your treatment is given intravenously, your nurse will be with you throughout your first treatment appointment and will watch for any immediate side effects. Your nurse will also take special precautions to safeguard your health by performing hand hygiene, wearing a gown and gloves, and verifying the medications with another healthcare provider. Medications from treatment are known to remain in the body for at least 2 days. For 48 hours after receiving chemotherapy, you will need to take steps to prevent exposing others to any of your bodily fluids. Casual contact, hugging, and handshaking are okay. During the time that you're in treatment, be sure to contact your healthcare provider if you experience any of the following: any side effects that last for more than 1 day, a fever of 100.4 degrees Fahrenheit or higher, bleeding, pain or redness at the IV site, inability to swallow, keep down liquids, or your pills. To prevent infection, practice good hand washing, take good care of your skin, brush your teeth after each meal, and avoid large crowds and people who are sick.
I went in anxious on my first day of chemotherapy, and I sat with my infusion nurse, and she was very attentive. She asked me a lot of questions. She explained everything that I was going to be experiencing. But then she did something I wasn't expecting, which is she spent a lot of time with me. And she was very busy. The infusion center was very busy. But she returned, she talked to me, we learned a lot about each other, we got to know each other. She calmed me down. And after a while, I felt that we had a friendship. She was my new best friend. So at the end of my hours in the chemo chair, I thanked her. I said, "I'm so glad that you had the time to spend with me today. It really helped." And she said, "We spend a lot of time with our brand new chemo patients. Every time someone's new, we watch them so closely." And I realized that all of the intimacy, all of the eye contact, all of the leaning in was really about her watching me closely. And what that did is it gave me a new confidence because I had a lot of chemo in front of me. But I knew how carefully I was being watched, how well taken care of I was. And that was key to me getting through it like everyone before me.
The emotions associated with a cancer diagnosis can be difficult to handle. At USC Norris, your multidisciplinary cancer team includes a licensed clinical social worker. This person is available to provide counseling and identify community resources and services to help you meet your needs. You do not need a referral to meet with a clinical social worker. If you think the service will be helpful to you or your loved ones, you may ask to contact the social worker at any time during your treatment.
We were in the car so nervous that we didn't speak, and you just want to be done with everything, but it was the first time and I knew it was not going to be the last time. So we got here, and I think as nervous as we were, but because we were treated, like a family, it just made it feel a little less anxious for us.
Physical activity is an important part of your cancer treatment, and routine physical activity is central to maintaining cardiovascular health. It can also help reduce fatigue, nausea, and energy levels, as well as decrease depression and promote better sleep. A physical therapist can help you establish an individualized activity program that's right for you. Please consult with your physician for a referral to a physical therapist. Eating well throughout your cancer treatment is central to the success of your treatment regime. A healthy diet will help you to keep up your strength, prevent body tissue breakdown, and rebuild and maintain your defense against infection. Side effects from treatment such as loss of appetite, mouth sores, or trouble swallowing may interfere with normal dietary habits. If you need assistance with nutritional modifications, please request a consultation with one of our registered dietitians who can help you choose appropriate foods for your unique dietary requirements. Changes to your daily routine to accommodate cancer treatment can be challenging, but help is available if and when you need it. We want you to be as safe and comfortable as possible. Please do not hesitate to communicate with your care team should you have any questions or concerns.